Hello, Dr. McCullough. Thank you so much for joining me today. For our audience who may not be familiar with Dr. McCullough, although he's very, very popular, Dr. McCullough is one of the most published and peer-reviewed cardiologists and internists in history. He's very outspoken about the COVID vaccines. He's been very courageous in his statements and in his videos and in his writings since the pandemic started. And Dr. McCullough, we have been following you at Gateway Pundit for a couple of years now. And thank you for your courage, for doing what you're doing. We have several stories, like I said, posted throughout our timeline. I was looking back, and we've been following what you've been saying for, like I said, over a year. So thank you so much for spending a little bit of time with us today.
Well, thanks, Jim. Thanks for having me on the program. I'm so happy I finally made the Gateway Pundit. I've set all the records on Joe Rogan, and we're coming up on 3 years. We're coming up on 3 years of the pandemic. I was the first to publish a treatment approach for the illness. I'm coming up on 60 peer-reviewed publications on SARS-CoV-2, the virus, COVID-19, the illness, how to treat it, how to manage it. I've given predictions by request by multiple media throughout the pandemic that have all been true. I've called every twist and turn to the pandemic. And I'll tell you, one of the papers that I published by invitation, I was a regular contributor in The Hill for the first year of the pandemic. I published a paper titled The Great Gamble of the COVID-19 Vaccine Program. And boy, that was in August of 2020. And boy, was I right. What a gamble that was.
Absolutely. And you've been getting crushed, of course, by the mainstream media, by Big Pharma, by our government for some of the things you've said. I noticed your Wikipedia page is littered with a lot of assumptions and I would say lies, outright lies about you. But it looks like you've been spot on from the get-go. And
well, I could say this much. I think a word that just needs to be eliminated from Wikipedia and all social media is the word misinformation. And I can tell you as a doctor, as you pointed out, I'm one of the most published doctors in the world. I'm the most published person in my field, which is the interface between heart and kidney disease in the world in history. One of the most published in COVID-19. That means I've just read more papers, done more analyses, given more interpretations than anyone in the field. I do have medical authority. And I can tell you the word misinformation has no place in clinical medicine. There are simply data, scientific data on an emerging virus, an emerging problem, scientific data, and there's two or more interpretive points of view. There is no such thing as misinformation. No one has agency over the truth. And so Wikipedia, as it puts the word misinformation up there, in a sense, Wikipedia is somehow claiming that they know the truth. These Wikipedia editors, there's some of them, one of them actually has made over 200 entries on my biography, of which I can't influence.
Oh, yeah. That's awful. We see that, of course, with Gateway Pundit. They've just littered our page with filth. But it doesn't seem right. But, that's the way the situation is today. But the gall of these people to lecture you on, your expertise on this pandemic. It's stunning what they do. In some of the remarks they've made about you, they don't have a background like you do.
In fact, many of them are anonymous. One of the most frequent Wikipedia editors, he goes by the handle the Altman. We don't even know who this person is. Do you know there are fact checkers that are largely anonymous, probably uncredentialed. We don't even know who they are, making false claims. So as there's a scientific citation that I'll make, and I'll cite the science, I'll cite the paper, first author, and journal and year, that there'll be a counterclaim put forward by an uncredentialed fact checker. And this is happening on the internet. People would ultimately need to decide who's the source of truth. I'm a continuously board certified internal medicine, cardiovascular disease. I received my degree in epidemiology from the University of Michigan. I have, like I say, amassed a publication track record that's second to none. And I've been correct. I've been correct throughout the pandemic. So, I think the public needs to understand who are they going to believe? Are they going to believe an anonymous fact checker who don't even know who they are, making a false counterclaim? Or are we simply going to follow the doctors who have learned how to treat patients? I'm in the trenches every day treating patients. I'm also publishing and providing commentary. I'm a frequent contributor on Fox News. And I've held myself out there through U.S. Senate testimony on 2 occasions. In fact, I co-moderated the second opinion testimony this year on January 24th, 2022. It's in the Senate record. What's interesting? I've never been confronted or approached by any doctor of any standing saying that what I've said is incorrect. Not a single chief of medicine, not a single chief of infectious disease, not a single CDC, NIH, or FDA person, I know a lot of them, has ever said I'm incorrect, because they know I have the right beacon on the truth.
Well, they would be pretty ballsy to do that, considering you back everything up with facts and statements and different studies that have been performed. I noticed on your Wikipedia, and I'm sorry to go back there again, I just got stuck on it today, but they said one of the statements you made was that and they said this was disinformation, that several people have died from the vaccine. And I think that's a known fact at this point. And of course, then you made statements about hydroxychloroquine and different treatments, which, it's just a shame that more people weren't listening to you, because you were right from the beginning.
Yeah, I never said the drugs were perfect. We simply looked for signals of benefit, acceptable safety, use drugs in combination. It was a mass casualty event. Doctors had to treat patients. And we know now from a survey by Verdkirk and colleagues that it's only those who did not get early treatment. It's only those denied early care. Doctors had a duty to treat those who failed in those duties. Those are the patients who are hospitalized and died. Those who got early treatment, they actually survived. Even if they were hospitalized, they still survived. So we always needed early treatment. The drugs were never perfect, and they've moved on from hydroxychloroquine, ivermectin, Paxlovid, molnupiravir, monoclonal antibodies. We've learned that the corticosteroids have played a critical role, aspirin, anticoagulants, nasal forms of virucidal therapy, very important. So the therapy is advanced. We should have always kept an open mind. No one has a right to declare misinformation or disinformation in the setting of an evolving emergency. Everybody should have been helping to get treatment advances to patients. And in fact, we didn't see this. And on the vaccines, it's not my opinion. It's in the peer-reviewed literature. There's over 1,000 peer-reviewed papers on vaccine-induced injuries, disabilities, and deaths. It's in the peer-reviewed paper. The conclusions of the authors in the peer-reviewed papers is the vaccine caused the deaths.
Right. A tragic, I'm telling a story of millions of Americans. I had a friend who was 80 years old, had diabetes, Parkinson's, came down with the disease. He calls me, says, Jim, I just tested positive. He was in a nursing home at the time, and he had been there for lockdown for 8 months. And I said, well, what are they putting you on? And he said, well, they're just going to watch me and see how I do. And I said, Eric, that isn't a program. They should be giving you or treating you with something. This was 8-9 months after the pandemic started. And so he died 2 weeks later, and a very lovely person, good friend of mine. And I started calling around to some of the hospitals. I called the Cleveland Clinic. I called other places. What's your treatment for these people who come in with the COVID? And nobody could give me an answer. There just was nothing there. And you were speaking out and screaming from the mountaintop about things we could do. But it was tragic that our hospitals weren't implementing, as far as I saw, anything that was helping these patients.
Now, I wasn't screaming from the mountaintops. I published the first peer-reviewed paper teaching doctors how to treat COVID in the American Journal of Medicine, August 7th, 2020 issue. It takes a while to get medicines fully published in highly ranked journals. And, I'm in that business, and published that paper. Is still the most widely read and downloaded paper of that journal for the last 3 years. Within 2 months, we had a home treatment guide by the Association of American Physician Surgeons based on my work. I had an updated paper in December of 2020 in Reviews in Cardiovascular Medicine, including monoclonal antibodies now, ivermectin, We subsequently updated it to include Paxlovid, molnupiravir, other agents. So this has been a work in progress, but the treatment approaches have been available to Americans. I would say within a few months of the onset of the pandemic. The Frontline Critical Care Consortium, they've done the same thing. American Frontline Doctors. In no nursing home patient has a chance with the early versions of the virus unless they receive early in-facility treatment. And that's what we were advocating. You know, in my book, Courage to Face COVID-19, which is a bestseller on Amazon, there's a chapter in there about my dad. My dad was in a nursing home, and he received early treatment in the nursing home, was never transferred to the hospital. Now, it was rough, but he got through the illness. And sadly, what happened to your friend is a manifestation of the lack of early treatment. And you're right, it's astonishing that the major medical centers never developed outpatient treatment clinics. Patients poured into urgent care centers, they got a positive test, or they poured into community testing centers, and they went home with no treatment. This is a tragedy to be diagnosed with a fatal illness, be a senior citizen, and be offered no treatment.
Right. And as we know, millions of people have died. And I believe that that was a major factor of that. I wanted to ask you one more thing before we got to the wellness company, because I wanted to talk to you about that. But it appears your Twitter account was taken down yesterday. Is that correct?
I was shocked after, I've been up on Twitter for a year, and with flawless and fearless tweeting without any first, second, or third warnings. The first thing that Twitter did is they erased all my followers. Suddenly my account went to 0 on followers, which is stunning. And then I was notified my account was suspended, actually permanently suspended. And, there was, in the days before, there was some destabilization. There was thousands of followers taken away and added. I think this is somehow related to several factors. One, I was suing Twitter. And in this suit, Twitter actually prevailed. Twitter prevailed on what's called SLAPP, that they filed a motion or threatened to file a motion of strategic lawsuit against public participation. So Twitter actually is claiming that they have the right to participate in a public conversation about COVID. And the method by which they participate is manipulating my account and your account and others. And they prevailed. The second thing that happened is news that Elon Musk had reinvigorated his take of the company, and we thought there was some destabilization of followers on accounts. We had evidence that Twitter was actively unfollowing people off my account. There was millions of people on my account each day, but Twitter actively unfollows them down to about 500,000. But then these destabilizing events yesterday, and then in fact permanently suspended from Twitter. So all these will go down in history. The censorship, the medical censorship is a topic that is now, I think, front and center. COVID-19 is largely, waning. We have there's a mild afterwave of BA4, BA5. It's very mild. It's like a common cold. Most people have been through it. It's important to know that if it's a second or third infection, it has a negligible risk of any hospitalization and death. It's like a mild common cold. So many people aren't even getting testing now. So that's basically where we are with COVID. It's basically fading out. But now we're going to pick up the pieces on medical censorship. AB 2098 was just signed into law by Gavin Newsom. That is effectively a COVID muzzle law on doctors. Doctors cannot give any truthful information now to patients on COVID in terms of vaccine safety and efficacy or treatment of the illness.
And I don't understand how that could be legal in the United States. When we're brought up one way and we hear about free speech and all of our rights, and then we start seeing things like this, it's really astonishing. And what is interesting too is the fact that they've been wrong every step of the way, and you've proved them that, and it was because of your speaking out and your research, you proved that they were wrong, and yet they still have the gall to censor you and shut you down. It's really amazing how bold these people are.
It's true. My Twitter account was largely, I was just posting recent manuscripts. So I would make basically a graphical abstract of a peer-reviewed manuscript and just put it out there. Just show people, there'll be manuscripts about, myocarditis deaths, fatal cases, Recently Patone and colleagues in Circulation published from the UK 100 fatal cases of vaccine-induced myocarditis. I'm just putting out the medical, literature. But Twitter claims that was COVID misinformation. Well, obviously it was peer-reviewed information, and Twitter is making a false counterclaim. So we know through American First Legal that's been working on this that Twitter is in active dialogue along with Facebook and YouTube with the CDC, and they are crafting the false agenda. Remember, the CDC still says the vaccines are safe and effective with no analysis on safety, no recognition of these published fatal cases of myocarditis, published fatal venous thromboembolism, allergic reactions. So the CDC and the FDA is willfully blind to the peer-reviewed literature, proving what the vaccine is doing in terms of injuries, disabilities, and deaths.
Well, I'm also on one of those lawsuits that's advanced, actually. So I'm glad to see that there is a bit of movement on it. But it's unfortunate that we're at this spot where we have to, fight for our freedom of speech in this country. I was hoping you could tell me a little bit about the wellness company and how this fits in with your vision of healthcare.
We've had 3 years of a catastrophe. It was not only SARS-CoV-2, the virus, the lack of early treatment, all the policy missteps, but now we've had the vaccines, where I think the thing that's frustrating patients the most is they go in for a primary care visit, and there's a doctor, in a sense, pressuring them to take a vaccine. And the patients have concluded the vaccines aren't safe. They know family members who have died with the vaccine, those who've had myocarditis, those who've had blood clots. I mean, this is a disaster. So, there's been a survey data by Zogby and colleagues showing 15% of people who take the vaccine have some new medical problem. There's a paper in the preprint service system by Skidmore, Michigan State, showing that 22% of Americans know somebody who's died or been injured with the vaccine. So it's out there. We don't need social media. So patients are going to the doctors. The doctors are still pressuring them to take the vaccine. And the patients are saying, I'm out of here. So what's the alternative? What's the answer? The wellness company has recently been launched by e-commerce juggernaut Foster Colson. And Foster has a vision of having a nationwide healthcare system called the Wellness Company that is actually active right now. Patients can join the Wellness Company, get a membership, start to get their prescriptions handled through the Wellness Company, have laboratories, other diagnostics ordered, and effectively offering an alternative from what's now a distrusted healthcare system.
Well, I spoke with Foster yesterday, and it sounds like an exciting plan, and it's like everything I've been looking for. And I'm not just saying that, but it's like this makes perfect sense to me, and it's easier than the healthcare got really difficult during the COVID to get in to see a doctor, to get to an urgent care that a lot of people like myself used to depend on. If I felt really sick or something, I needed an antibiotic, I'd go into an urgent care. You couldn't even get into urgent cares during the height of the pandemic. It was horrible, and you had to sign up a day beforehand, which has never happened in the U.S. as far as from my experience. But so this really seems like a good plan, and you're going to be involved in this also, correct?
That's true. I've taken the position as the chief scientific officer, so I'll be working with a cadre of colleagues, experts, medical specialists, primary care experts, to guide the company. And the company will be able to handle, obviously, urgent care types things like, upper respiratory infections, urinary tract infections. There are laboratory packages that apply to certain illnesses, various diagnostics, pharmacies that will get the medicines to patients promptly. And very importantly, nutraceuticals, supplements, coaching, wellness. There's a big focus here of patients taking responsibility for themselves. And you know what? Employers are going for this. Employers are seeing their costs go through the roof. And with the packages with the wellness company, they're going to offer it to their employees and say, you know what, use the wellness company. It's going to be far less expensive than co-pays and all this billing to insurance, which is, just increases the cost dramatically. it is a bright new solution. A lot of credit to Foster Colson and the team that he's assembled. He's brought in large groups of doctors now that will be working initially in a virtual environment. I think it'll quickly go to face-to-face centers around the country. But it's a brand new model, and it's going to have a lot of expertise on the remaining acute COVID cases, as well as long COVID and now vaccine injury syndromes. This is going to be a very, very important book of business. You know, patients who have vaccine injury, myocarditis, blood clots, you know, they go see their doctors, and the doctors say it's not due to the vaccine. And patients are absolutely flabbergasted. They take the vaccine. The FDA says the vaccines cause these problems, and the doctors are denying it.
Right. That's unbelievable, especially with the children who never should have been taking the vaccine. There was never any evidence from the get-go, from back in Italy, when Italy had its outbreak, that children were being infected in a large extent by this disease. It just wasn't there. You know, I talked to Foster, and he brought up a term I had never heard. He called it, instead of prescribed, he called it described from different pharmaceuticals, and that was part of what he wanted to do. Can you explain that a little bit?
You know, there are some opportunities for what's called deprescribing. So as patients improve, I mean, one of the single greatest things that people can do is who are overweight or obese is lose weight. You'll be amazed how many medicines can be basically deprescribed or not needed anymore with weight loss. Another is improving diet. As diet is improved, it is amazing how many medicines are not needed. And not only that, but there's a lot more research now on nutraceuticals and supplements, which are, you know, available over the counter or available through the wellness company store. They're very inexpensive. And there are conditions where there's just classically medicines piled on that are ineffective. So for instance, peripheral neuropathies. Oh my Lord, there's so many peripheral neuropathies now post-COVID and with the post-vaccine injury. And all the drugs that are used have toxicities. They're minimally effective. Now, there's an entire area of neuropsychiatric disease, for instance, where drugs are prescribed, they're minimally effective, and alternative approaches are being sought. So, you know, we really are going to bolster with experts who have the ability, in a sense, to deprescribe or safely take people into simpler medication regimens. Not every American needs to be walking around on, you know, 6 to 16 different prescription medicines. I mean, we have to get to a point of being reasonable. Now, I'm a traditional allopathic doctor in my practice here in Dallas. I prescribe drugs every day, but I do recognize there is a risk of overprescribing, and I see this commonly in American medicine now.
It sounds like an idea whose time has come. It really does. I'm excited to hear more about it. Can you tell people how to sign up for the wellness company? Do you have any idea how we go about that?
It's a pretty simple website. It's twc.health, and it'll take you right into the website. I encourage everybody to sign up with a subscription. Just get the benefits. It's very affordable. And then that way they'll have access. Many are signing up to, you know, get on base with a primary doctor. So instead of having to get in line, as you described, to go to an urgent care, just get on it's on an iPhone app and cell phone app. So just get on the app. That way you can get your medicines refilled, you know, get other benefits. There's some wonderful health and education media that's being developed right now, coaching, diet plans. I can tell you as a doctor, you know, I have always recommended in certain conditions the use of nutraceuticals and supplements based on randomized trials and high quality sources of evidence, but I've never had all the different components assembled into a single supplement. We've actually done that along the lines of cardiovascular, about immune boosting, and other conditions. So I think the supplements are particularly unique and beneficial, and people will find them useful and evidence-based, because I've been doing this in my practice. I've just never had, in a sense, it all assembled into a single affordable supplement.
Fantastic. Well, thank you so much for spending some time with me, and I look forward to have conversations in the future. And thank you for your courage again, for standing up, and we look forward to hearing more about the wellness company. Thanks so much, Doctor. I hope you get your Twitter account back.
Well, thanks. Listen, you can follow me. Go to petermcculloughmd.com. That's my link tree. That takes you to all my social media. as well as my new book, Courage to Face COVID-19.